We got one more minute, so we can still answer questions and we can answer
Okay,
questions going
I've
through.
got a question from Australia here. I'm having a bit of trouble with some of the grips coming off, and I'm getting people to glue them on.
Yes, thank you for that question. If I can just be honest among friends, it has been something that I've been thinking about and working on for a really long time. I I feel like one of our competitive advantages is that we don't use glue. So many clients really appreciate that. And for my average senior patient, my average senior lab or pug plodding through life, it's fine, it's perfect. But if the dog has any hint of neuro issues and they have CP deficits, I mean, even subtly, if you can imagine a paw occasionally scuffing or dragging, that motion backwards with these high friction toe grips will pop them off. So glue is the answer, and I find that super glue works better than tissue glue. We use Scotch super glue gel, and we'll probably talk about it today, Lori, about why I really love them for my neuro cases, but I have to glue them on all my neuro cases. And for three-legged dogs, tripods, I think they're compensatory gait. You have to glue them on. But I will tell you that we are actively, like very actively working on a V2 that will hopefully solve that problem more intentionally. So thank you for the question and
That's
your
yeah.
honesty.
No, no, thank you. Because I do my obstacle course work is the bush. I'm in country Victoria, so it's awesome. I don't need cavalettis and weaving poles. We just go down the bush, and they lose them again, like you said, because you've got proprioceptive deficits with some of these guys, and even the ones that don't. This is Australian bush.
Yeah.
So no, that's good if it's okay to glue. And to be honest, I always use super glue anyway for nasal gastric tubes and everything. I never use tissue glue for those anyway.
Okay. I'll
Interesting.
put in the chat the video that I kind of demo it. I mean, it's very intuitive and it sounds like you got it, but I will put that on the in the chat because I have a little video where I talk about how I do it and what cases I do it for.
Perfect. All right, you guys ready to get going? Well, you put that in the
Yep.
chat, Julie. I will introduce Dr. Julie Buzby, who is a dear friend of mine and fellow mom, DVM. Graduated from Kansas State University College of Veterinary Medicine in 1997 and began her career caring for all animals, not just dogs, but all animals. She was certified in canine chiropractic therapy in 1998 and acupuncture in 1999. Do you want to know something funny, Julie? I was certified in acupuncture in 98 and chiropractic in 99. Isn't that funny?
I know we cross paths and it's so crazy how long we've been friends.
Yes, yes. In 2000, Julie built her own veterinary hospital, Vexetra Vet Healthcare Center. She put her passion for integrative medicine into practice and she built it up and then sold it in 2008 and moved her and her family to Beaufort, South Carolina, where she practices part-time. She seeks to integrate the best of Western medicine, alternative therapies, and creative tools for maximum wellness in her patients, most of whom are senior dogs. Julie is honored to serve on the advisory board for the Gray Muzzle organization, which I was just looking at that stuff today for something else. So near and dear to my heart. Um, Recognizing the need for nail-based traction for dogs, Julie launched Dr. Buzby's toe grips at NAVC/VMX in 2013. And in 2019, the company evolved from Dr. Buzby's Toe Grips to Dr. Buzby's Senior Dog Company. It's a brand focused on educating and empowering people who care for the best possible care for their senior dogs. So, without further ado, this is my dear friend, Dr. Julie Buzby, and I have a whole bunch of questions for you. So, if it's okay, Julie, I want to start with how did you get interested in senior dogs and dogs specifically that were sliding all over the place?
So, like you, doing chiropractic and acupuncture, I did occasionally see like a really interesting case of a dog that was a repro case that they flew in on their private jet for
Mhm.
acupuncture and, you know, cats, rabbits. But for the most part, the patients were senior dogs. So that's what I would see day in and day out, particularly once I moved to Beaufort and I was exclusively doing alternative medicine. And when I did my appointments, I would just sit in the room with people. I didn't, I wasn't doing four rooms at once. It was like one appointment at a time, and I would sit there with them. And I loved that aspect of developing the relationship and learning all the behind the scenes part of the care of that dog. And in so many cases, these senior dogs, we know that pets are family, but I feel like for senior dogs, it's even a notch above that because I'm gonna like tear up thinking about this. But the stories of this was with me when I lost my son.
Oh my gosh.
This dog was with me through a horrible divorce. This dog was with me through this legal thing that dragged on for 3 years and almost killed me. This dog was with me through, all just the valleys of life. And I'm like, these senior, so you just, what's not to love about a senior dog? But I just recognize that these dogs are like, they just deserve badges of honor beyond the precious value they bring as companions. They've been truly the therapists and the friends that were faithful in all seasons. And I just came to just more every year, I just seem to love them more and love the bond and the relationship and all that entailed.
Awesome. And how'd you come up with the brilliant idea of Dr. Busby's toe grips?
I love to brag about what a brilliant idea it is because it's not my idea. So, a client of mine initially came up with the idea. I was doing acupuncture on his senior Australian Shepherd, and I was at an open house at the vet hospital that I was working, and I had my little alternative medicine table to talk about this aspect of the practice. It was just kind of me doing my thing there. And he came up to me and he said, "Look what I did for Morgan." And he had this early prototype on her toenails. And I swear, like my hair all stood up on end, like my life passed before my eyes. Like, really, I am not exaggerating because I thought, oh my gosh, I've been looking for this my whole career, but I didn't know what it looked like. But of course, nails are where dogs get their traction from. And
Mhm.
if we could just give them the ability to have grip on the hard nails that don't grip hard floors, that's the ticket. That's the solution. So I was super excited. And he was a third generation inventor and was working on patenting things in the art world and had no interest in bringing this product to market. And I didn't either. I just wanted it for my patients. I wanted it from all my patients. And I'm like, I know because we live right by the beach. So nobody has carpet. If you have wall to wall carpet, you don't need this product and you don't have this problem. So everybody's got, fancy hardwood and tile and travertine floors and painted concrete and whatever else. And it was a huge issue for me because it didn't matter how much chiropractic, acupuncture, nail trims, trimming the fur. Yes, those things are valuable, but I could do all that. I could do Western meds. I could do herbs, physical therapy, teaching them cavalettis at home. Like I could do everything in my little toolbox and I couldn't stop the biomechanical problem of slipping. So he very graciously, and I'm thankful to say that we're still friends to this day, signed over the rights legally. And I just said, like, I need this in my toolbox. And then as I started to see the impact from my patients and all the receptionists and technicians in the hospital that I worked with, they had senior dogs and they were all the early beta testers. And the stuff that we saw was so much greater than just traction. And I thought, good gravy. Like what? I mean, it would keep me up at night thinking, like,
Right.
I have this moral obligation to help other dogs benefit from this. But what do I know? I mean, I'm a veterinarian. I have no idea how to bring a product to market. So that's the story behind the idea. And then being the type A perfectionist that most of us veterinarians are, I spent a year in R&D and I had one client whose Newfies were wearing them. And every time I would see Dave, he would say, "Have you sold them yet? Like, are they available yet?" So after a year of tons of research and just making sure, above all, do no harm, and so happy that I was able to work with a veterinary school who did a study on baseline impact on gait. We
Mhm.
brought them to market, and it's hard to believe that's over 12 years now.
Isn't that amazing? So you said that do the dogs have problems sliding and this stops the sliding. Why is traction so important for dogs not only as they get older, but at any point in life?
I think the pet parents knew this and saw this because besides boots and socks, there was nothing else on the market. Um, Throw rugs and yoga mats were my recommendation at that point, but there's like a whole dog traction category, but there was not at that time. And I do really think that pet parents would see things at home and realize this is not safe and it's not healthy for my pet. But I
Right.
don't think the veterinary world really understood, and if anything, thought, this concept may be a little anthropomorphic in
Mhm.
doing imbuing, I don't know my verb there, but like imparting these human feelings and characteristics onto pets, but it's totally not. Confidence is a direct, it's crushed when you're slipping and sliding around your house. And these dogs are smart. They realize I'm not going to do that because it's dangerous. I don't want to get hurt. I'm fearful. And so they start to isolate themselves to parts of the house that do feel safer, whether that be one room that has better footing or their crate or a dog bed. And they're pack animals and they need to be with their people and be with their family. So it's this whole big thing like traction. We can just talk about the biomechanics of slip and fall injuries and
Yeah.
impacts to the legs and the pelvis and all the chiropractic stuff. We can talk about all that, but there's also this psychological fear factor, and fear-free homes has been, and fear-free vet med was like this big giant and is this movement. And I feel like this is a huge part of it that wasn't really being considered. So I think traction has a way greater place in our treatment of patients and being an advocate for our patients than veterinary medicine has realized.
Yeah, excellent. Yeah, I mean, confidence is huge for dogs. And like you said, stopping the splay so that they're not coming out and pulling their pectorals or their pectineus muscles and adductor is super, super important. So you've got other traction devices like you just mentioned. Now you said there's a whole category. What makes toe grips superior to the boots, the socks, and everything else?
So I have to confess that as I saw more and more products coming onto the market, I was thinking, so what happens when there's something that comes onto the market that I actually like better than toe grips? Like I'm a transparent person. I'm gonna be like, okay, well, I really like this one, but don't forget about toe grips. Thankfully, that's never happened, and I want to explain why. I love toe grips. So first of all, yoga mats thrown all over the house or runners, they work great and they were my solution prior to toe grips. The problem is it's not traction that travels with the dog. So if the dog's going to be exclusively on them, it can be a good solution, but the dogs love to go lie on the cold hard floors and they have to get up off the cold hard floors, and then you've got people tripping over the rugs, and I don't think it's the perfect solution, but it does work. The other category is boots and socks. The problem with boots and socks is dogs are not people. So many, tack, so many, and for horses, like we have to remember that quadrupeds are different than bipeds. And we have to think about what is the natural biomechanics for this species. So I think boots and socks have their place for like protection from snow, protections from elements of heat, maybe protection from a wound if there's a wound that needs to be bandaged and protected. But for a traction device, no, because proprioceptive receptors are so prevalent in the jaw and the toes. And when we put these dogs in socks and booties, we obscure some degree of their natural receptor input into the environment that they're in. And I thought this was so interesting. I read this as a VIN article years ago that it was written by a veterinarian who was working September 11th at the Pentagon and said the dogs that are on the pile here, the natural thought would be that they would be in boots to protect their feet, but they're not. We have them like naked feet.
Mm-hmm.
The article didn't say that. That's my interpretation because they needed all of that ability to have proprioceptive input and to be able to grip and flex and bend walking through that horrible terrain and surfaces. So I was like, yes, that's exactly it. So I don't want to obscure that. I want to enhance that. Then we have things that go on the paw pad surfaces. So to some degree, because the paw pads are in contact with the floor, yes, they're involved in traction, but that's not the traction mechanism. If you ever have seen dogs running or even dogs in a veterinary hospital reception area where they're like they're up on their tippy toes and they're terrified because they are slipping and they know that they can't walk, but they're like on their tippy toes because the brain's saying like dig in your nails, grip with your nails. That's the natural mechanism for traction because as they're flexing and they're gating, those nails act like soccer cleats on surfaces that have some ability for cleats to work. Grass, carpets, yoga mats. So when we put stuff on the paw pads, first of all, like I know that there's not a ton of sweat coming out from paw pads, but there is a sweat factor there. They're also sensitive tissue. I can't just, you know, put a razor blade into a paw pad and the dog not feel it. It's a sensitive tissue. And so I just didn't want to mess with sensitive tissue. The nail itself, the quick, is encased within the hard keratinous nail and doesn't even come all the way down to the actual complete end of the nail tip. So that was why like I was not a huge fan of things that go on the paw pads. Plus, they typically don't stay on all that well. So those are the major categories and why I love toe grips and the fact that they're on the nail tip. They're so minimally obtrusive, which is why so many people look at them and they say, what in the world are these even going to do? Like, how can they even help a dog? Well, you have to understand the whole biomechanics of what they're doing. They're just working in one place. We call it the grip zone. It's the only place they're working. The dog's doing their natural thing, and it's giving the nail grab that otherwise a hard nail wouldn't have on hard floors. And I love that they're open tipped at the end. That was actually really important to me in the design because the dogs now have this kind of soft stop grip, but they still have their nail tips. And lastly, sorry, I'm getting fired up. Coming out of the horse world, the little bit or not, or maybe even a lot of bit that you add to the end of the nail is more that that dog has to break over. We're already talking about frail, typically. Senior dogs are more frail, have more balance issues, just like people. And so now I'm going to ask them to have to break over something additional on their nail. It's like the whole same principle of having nails that are too long. And so the fact that it's just the littlest amount that's needed with minimal change in the actual anatomy of the dog and the way that the dog's already interfacing with gravity and the surface is why I love them.
Perfect. I do want to add, you mentioned how a lot of the proprioception is in the toenails and in the TMJ. For those of you who don't know, keeping the nails short are super important. Anytime you hear the dog clicking when they're walking, that end of the nail hitting the ground sends a message to the brain that the dogs are going uphill, and it's actually going to change their posture and can lead to lordosis or sway back and pain in the back. So yes, use your toe grips and make sure your nails are short enough so that they're not clicking as they walk. Great explanation, Julie. Next thing I have is, can toe grips help build muscle? And if so, how?
So not directly, but indirectly. And that was one of the things that I was in that early beta crop from the vet hospital. The traction's instant. I mean, as long as the dog I don't want to say is smart enough, maybe is brave enough. If the dog is like, okay, I'm going to actually try these and see how it goes. I mean, the traction's instant, seconds, minutes. My longest dog that I took to see an effect was a patient of mine named Molly, and she was a Schnauzer, and she couldn't walk through her kitchen. So she had this
Oh.
circuitous route that she had to take, and it took her 3 weeks to trust herself to walk through the kitchen again. And her mom said, Molly's just not a risk taker. So that's pretty instant. The muscle, I don't see it in every dog, but I see it in a lot of dogs. And the owners are typically the ones that are picking up on it first if they're really intuitive. And it may be 6, 8, 10 weeks from starting toe grips, and they'll say, I'm starting to see the dog build muscle. And I've heard it from a lot of veterinarians who used it on their own pets. And the idea is, well, of course, I mean, the dog's now getting up, whereas before they weren't as likely to get up. They're standing longer, and I'd like to put a little asterisk and talk about that more. They're using themselves more. So it's, they've gone from couch potato, which may have been more fear-based, to now use it or lose it. And so the muscle responds to that. So an indirect impact.
Nice. Now, what was your asterisk for first standing?
So Kansas State University College of Veterinary Medicine did a study, and if you look up the study, the title is like it has something about like minimal impact in the title. So I have people sometimes that'll come on social media and just say like, I looked up this study and it said they had minimal impact. This is a scam. What the minimal impact was, the study was a baseline study to say, do toe grips negatively interfere with the gait of a normal, healthy dog? And so that's where the minimal impact came in, um, that they didn't negatively interfere with normal, healthy dogs on a force plate, which is so important. Like, that's the first question we should be asking about all these products. Are they interfering with the dog's gait? Above all, do no harm. Could they be making things actually worse for that dog in terms of gaiting, posture, etc.? So I love that it had not, the study had nothing to do with traction. It was like a preliminary study, and I love that we have that. But hidden in the verbiage of that study is something that I didn't even notice when it first came out. Like years later, I read it and I was like, this is significant. It said that dogs wearing toe grips stood longer. And I thought,
Wow.
oh my gosh, that is, so maybe there's something to building muscle there too.
Yeah.
It's like, are we giving anti-fatigue mats to these dogs? Because I don't know how comfortable it is for them to stand and, to your point, the nails be hitting the floor.
Hmm.
And although what you described was absolutely true, and I've believed it my whole career, and prior to toe grips coming into my life, because I was also trained with by Judith Shoemaker, like I was a nail trained warrior. But I find that the average American dog, it's really hard to get that as the standard because we're getting them too late in the cycle. And it's meaning, I think if you start that way and spend their life with that as the standard, great. That's perfection. And show dogs are a great example of that. They can have super short nails. But the average senior dog who's had long nails their whole life, absolutely, we want to do our best to keep them trimmed as short as possible without hitting the
Right.
quick. And that's the problem because then you don't necessarily always get this gold standard. But does that does that affect their comfort level standing? I don't know, but we do have a study that said wearing toe grips, they stand longer. So I think it's pretty cool.
Excellent, excellent. And I can go on the other side. In humans, they show that people who are bedridden within 3 weeks can lose up to 20% of their muscle mass. And by just standing them for 10 minutes a day, it drops that atrophy or muscle loss by 25%.
Wow.
Yeah, so standing certainly plays a huge part of keeping, if not building, muscle mass. Awesome. So I know toe grips are usually we think about them for like geriatric or frail patients, but in like my head, I also think about them for like neurological conditions like disc disease, FCE or strokes, ataxia. What can you tell me other times that you would recommend toe grips for dogs?
So that's a big category that I like to talk about because it's one of my favorites, neuro cases. So we've already said early on, I think before we even started, from a question, which was great, you have to glue them onto neuro dogs because
Mhm.
that dragging, that scuffing will just pop them right off. But they're so great for my neuro cases, and traction's maybe the least reason why that's the case. Um, they provide proprioceptive stimulus. And I didn't know this when I first launched the product. I got this feedback from the rehab world, and there was a big rehab practice in Massachusetts. And the one of the rehab practitioners called me and said, "Hey, we've heard about your product. Would you be willing to send us some? We're going to try them on the owner of the practice's dog." And they said, this dog is neurologic and has deformed nails, but we'd like to give him a try. And I'm thinking, oh my gosh, like nothing like out of the gate, the big test, because I didn't know how this was all going to go, the deformed nails. And they called back, I don't remember the time frame, 6 weeks, 8 weeks. It was kind of a chunk of time later. And they said, I think the dog's name was Norman. And they said they are helping Norman on any surface. And we believe it's because they're providing proprioceptive stimulus. And I was so excited. So, and then since then, absolutely, I believe that and have observed that in my own practice. The traction, again, we talked about instant. That seeing that benefit, I think it takes 6 weeks-ish. And then the other reason is, as we know, dogs that drag their nails, eventually they become these little bloody stumps. If
Mhm.
you're at the bloody stump stage, toe grip's not the right product. There's not enough nail to get the toe grip on. But toe grips are nail sparing, meaning when you glue them on, you now see the toe grip getting worn down on the top, which is never where it wears. It only wears, I told you, on the grip zone on the bottom. And so they're nail sparing to help protect the length of those dogs' nails, which is a gift because it's really a frustration for the poor dog and for the owner when you've got bloody spots all through the house because the dog has worn down nails that are, the quicks exposed. So I love them for my neuro cases. If the dog's severe neuro, where they're dragging so severely, I don't use toe grips because I don't want to increase friction. If this is really the predominant way the dog's moving, I want them to still have some hope for flipping that paw and getting it right, and I don't want to increase friction there. So I say mild to moderate neuro cases. I love them for cruciate disease, non-op, pre-op, post-op. It's one of the few cases where I can just put them on the hind paws. I always want right to left symmetry. Front to back, I think for the senior dogs, even I do believe the majority, oh, this is a quadruped thing where they get their impulsion. So I think the majority of the benefits coming from the hind end, but some benefits coming from the front end. I can't quantify that, but let's just make up a number of 10 to 20%. I don't know what it is, but I do know if I can help a senior dog with
Mhm.
traction and safety and confidence, some smaller percent, I'm thrilled with that. So I do all four paws on almost all senior dogs. With cruciates, I might just do the hind paws, and I'm maybe just using it temporarily if it's not a senior dog because it gives them confidence to put that paw down, to start using that paw again. And some of my most wowing moments with toe grips in my own practice have been cruciate dogs.
Cool. Very cool. So real quick, back 20 something years ago, before toe grips were around, when we had dogs that were neuro, we would literally take that white tape, you know how we used to put like lines and stuff like that in, and wrap it around their toenails, and that would increase proprioception. Or we would take hair ties
Yes.
and put it around the feet, twist it like a figure eight and go around just the two middle nails. And that would help them with proprioception. And we would tell people it's like if you put a ring on, right? What do? You play with it because you're aware of it. And then when you forget about it, you take the ring off, and all of a sudden now you play with it again because it's something different. So we're stimulating the brain and working on those neural connections to help with balance, proprioception, knowing where their body is in space. And I do have to tell you, Ellen wrote in that Norman was Dr. Marjorie McMillan's lab.
Oh, I hope I have the story right. That was about 12 or 13 years ago, and I'm glad that I remembered his name. But that was really fun, and I developed lifelong friendships from that situation. So awesome. Thank you.
Very cool. Very cool. All right. So now I know you love the senior dogs, and I hear that you've recently expanded your product line to help aging dogs in another way. So you brought a new product to market, Brain Boost. Can you tell us why you feel so strongly about this and how it's helping our older dogs?
Yes. So I had this one hit wonder product that's patented and like this is what we do. And I was busy with my family and lots of kids and homeschooling. And so I just was thankful. I mean, like I said, I told you from the beginning, my goal was just to have these for my own patients and then realizing like, wow, these can really help a lot of dogs. So getting them out there. But I didn't like it was never in my idea that I want to have a pet product business or e-commerce store. That was not on my radar. However, I started to realize we had something special going in that I had a blog and we were having like a 500,000. I think now, thanks to AI, it's maybe closer to 300,000, but like a 500,000 people a month on our blog. And the metrics tell you how long they're reading. They were staying on for like 15 minutes reading content. And I was so happy because our content is veterinary written, veterinary edited. The person that does our photos in our blog is a veterinarian. We have a proofreader who's a veterinarian. Like, I'm just so happy and proud that we can put this content out there in the world and that it's helping people. We just got an email today from somebody from Argentina who said, it was translated, it was coming in from a translation, but it said something like, I was so happy to find your articles. They helped me so much to make some decisions. I
Aw.
just lost my dog due to a ruptured splenic mass. And so you had an article on that. You also had an article on euthanasia, an article on grieving, an article on helping my other dog grieve. And like, we don't make any money on the blog. We don't put advertisements in there from other companies or anything like that. If it's appropriate, we will mention our own product, but that's just a labor of love. And I just started to realize we can do more for senior dogs. And again, just like toe grips, I'm reading all these articles. I know you're a research hound. Like, I know that about you, and I'm not nearly that. But even in my little world, I was seeing enough articles and being at conferences where the speakers were talking about MCT oil for dogs. And I'm thinking, okay, where do I sign me up? Where do I get this stuff? And there wasn't any formula on the market that matched what the research said to use, which was C8 and C10. And we can talk about why that is. There are prescription diets, of course, that are using MCTs, but with a senior dog, so often I'm not going to tell my client, your dog that's finicky, already you're struggling with the food, hey, let's change to this diet. So I just wanted something that I could top dress onto the food. And so we had to basically come up with it. And so Brain Boost was born from the same place that Toe Grips was born, which I think is where all my products are going to be born from. Like, I want this product and I want it for my patients and my dogs. And so let's figure out how to do it. So that's what we did. Another year of R&D. And we worked with a vet in Australia and her husband and a PhD out of the UK. And then vets in the US who had been working with them and kind of pulled together this body of information. And it's been so good. I am so excited.
Very cool. Let's talk a little bit about canine cognitive dysfunction. So it's a syndrome, but it's very much real. And even though dogs, usually the average age that they show clinical signs is 9, some dogs as little as 6 or 8 years start to show clinical signs. And by 12, 30% of dogs have cognitive canine dysfunction. And by 15, almost 70% of dogs. Can you review the symptoms of canine cognitive dysfunction so everyone knows exactly what we're talking about and what to look for in their own pet?
Yeah, so let me first say this is incredibly underdiagnosed. And I
Mhm.
said I'm so excited about Brain Boost. And one of the reasons I'm excited is because it's made me a better veterinarian reading the stories that people have written in. And yes, this is anecdotal, but people will write in, and a lot of them are vets because we launched this product at VMX and then went to WVC. So all of our initial buyers were veterinarians, often using it on their own pets. So I think they have, the observation quality is really high. But they're writing these stories and they're saying, this was the only variable I changed, and this was the change I got. And I'm so convicted because I'm thinking, good grief, I'm spending an hour with these clients doing chiropractic and acupuncture appointments, and we're talking all that through all this stuff. And they may be telling me some of this stuff, and I never associated with cognitive dysfunction. And I think that's the real trap for us all as pet parents and as veterinarians. It's slow and insidious. And, the dogs are aging, they've got other issues. And so we just lump that into one thing, not realizing, wait a second, this can be cognitive decline. And there's a lot of things we can do about that. So there's an acronym for the symptoms. It used to be DISHA, DISHA. Now it's expanded. This is the 2.0 version, DISH all. So think about, I mean, you can just liken this to your poor elderly grandmother if you've ever been to a nursing home and seeing people there. I mean, the D is disorientation. So we see that as going to the wrong side of the door when they're trying to go out, sometimes vocalization, staring at the wall, getting stuck behind a piece of furniture. The I is interaction. So that can be a change in interaction with people, also with other pets in the home, and it can also including aggression. So that bond that you have suddenly is changing, or just like said, people, I don't recognize my daughter, that kind of thing. Sleep-wake disturbances is the S, and these are dogs that are sleeping a lot more during the day. Not an uncommon senior dog thing, but then seeming to be more anxious and awake at night, pacing around the house at night. And sundowner that we describe in people is, I think, a very real thing in dogs. Okay, so DISH, house soiling. So now your housebroken dog is now having accidents.
Mhm.
A, activity. So changes in the activity, changes in either what they want to do, time of day that they're active, or just, not being active at all. The other A, I think, is a really big one, and that's anxiety. I think that's one of the biggest signs of cognitive decline. I'm not talking about a dog that's had separation anxiety their whole life. I'm talking about a dog that all of a sudden, as they age, they're just becoming so much more anxious. That's a cognitive decline symptom. And then the last one is learning. So one of the testimonials that we got was this lady whose dog was a certified, don't quote me on the letters because I wasn't familiar with it, but it was like a AKC certified trick dog champion, something like that. And she said we just had stopped trying to learn any more tricks because this wasn't, it wasn't working and she wasn't interested. And within a few weeks of taking the brain boost, and I know this sounds like a test, this sounds like an infomercial, but it's just meant so much to me personally to say, oh my gosh, I've got to ask better questions of my clients. Like I can do more here. And the prevalence of how often you just gave us the numbers. I mean, if I'm seeing all these senior dogs a week and I'm diagnosing cognitive decline once a month, something's not matching up and I have to be more intentional and more aware. So anyway, last one, learning. And that dog, there was a younger dog in the house that was actively being trained. That dog started getting in on those training sessions with the younger dog and learning new tricks. And the lady was so happy. Like that was quality of life for them. Back to their trick dog training.
Excellent. Shawnee just typed in, my senior dog pup became noise sensitive as she aged. So yeah.
Yes. So often we think of deafness, but it can go both ways. And that was, I'll just say one more, I promise, my last one. That was another one that blew my mind. Only variable changed. This lady wrote in about her dog. I think it was a veterinarian who wrote in about her dog and said, we started the brain boost and now the dog's hearing. And the dog had been deaf, which of course, I mean,
Wow.
senior dogs, like, yes, deafness is not uncommon. And it's like, not saying it's all cognitive decline, not even saying it's majority cognitive decline, but this one dog, she's like, he's hearing again. And if you look in the literature, apparent deafness is recorded as a symptom of cognitive decline. So that's interesting that both ways,
Yeah.
hypersensitivity to noise too.
Yeah. Well, and it goes with that anxiety, right?
Yeah.
So now it's that noise that I can or can't, well, obviously have to hear, but now that brings on the anxiety. All right. So we just talked about canine cognitive dysfunction, and all the different clinical signs. So can you tell us how medium chain triglycerides or brain boost actually help with these signs?
Yes, so I had to do a deep dive because I did not remember any of this from vet school. So there's short, medium, and long chain triglycerides.
Mhm.
The main four for medium chain triglycerides are C6, C8, C10, and C12. C6 has a bad odor and bad taste and is more associated with GI upset, so not appropriate for dogs, a supplement. C12, there's some dispute about this out there, but all of the research is done with C8 and C10. C12 is more prone to GI upset and potential pancreatitis because it's a longer chain triglyceride and it's processed more like a traditional fat. C8 and C10 are the ones exclusively in Brain Boost. There's nothing else but C8 and C10. They're very easily digested. They're quickly broken down they're processed by the portal vein through the liver. They're broken down into ketones and ketones. So we're not talking about ketones like DKA, diabetic ketoacidotic cats. We're talking about ketones, food related, digestion, broken down to ketones, readily cross the blood-brain barrier. And so one of the big ways they work is as we age, people, dogs, I guess all species, but I know for sure in people and dogs, we go through our neurons, the functional cell of the brain, glucose hypometabolism. So we all think about blood sugar running our brains, right? Well, if your neurons don't use sugar as efficiently and effectively for energy as they once did, you're going to have cognitive issues, but they love ketones. That's why if you've ever fasted and you're like, I'm feeling great, like I have no brain fog, I feel like $1 million. I'm on this fast and yeah, I'm hungry, but like cognitively, I am like on par. It's because the brain runs really well on ketones. So that's one way that they help. They're an alternative energy source for the brain. Number two, they have so many cool effects. They help with mitochondrial regeneration and biogenesis. So your body will actually make, and there's tons of studies. Anybody can DM me. I'll send you a white paper that we did that I think has like 35 studies cited, not just in people, but the majority of them are actually canine studies. So
Uh-huh.
mitochondrial generation and repair, neuroinflammation, it's good for inflammation. There's so many different neuroprotective. It's like almost a little crazy how beneficial MCT oil can be. And like I said, we've known it for years in people and in dogs. And I just wanted something to be able to give my clients that I knew I felt good about, that was safe. And So we committed that the formula was going to be organic and non-GMO and ethically and sustainably sourced because we knew that the clients would love that and that was valuable for them as a consumer. But I really just wanted C8 and C10 only. That's what I was looking for.
All right, so real quick, you talked about mitochondrial repair. And now I'm sure there's some veterinarians listening, but I'm sure there's pet parents who may not know what a mitochondria is. You want to go into that real quick?
You'd probably do a better job of me, but I'll start here. So, high school biology, the powerhouse of the cell. It is where a large part of the the Krebs cycle takes place, and we produce ATP, which is like the currency of energy for our body.
Yeah, that's great. Absolutely. I'll throw a little science in there. So our body makes ATP. So ATP to me is like the gasoline instead of for the car, but for the cell. So it's the energy. And we can make a small amount of ATP outside the mitochondria anaerobically, so without oxygen, or in the mitochondria, we can make a large amount, but you need oxygen and you have to use, like you said, the Krebs cycle and have cell respiration and have things happen around the mitochondrial membrane to allow, and it's a difference between like 2 ATP and 36 ATP. So it is a huge difference. And the MCT actually allows the things that are happening in the mitochondrial membrane to happen much faster. You don't need L-carnitine to bring the fat in and make a lot more ATP to allow the cell to do whatever it needs to do to heal or to do whatever that cell needs to do. So awesome. Cool. All right. So when I think about taking oil, my brain always goes to like fish oils and burping fish oils and that's always like really I don't eat fish, so that's super gross to me. So the questions here would be, do dogs like the taste of the MCT oil? Do they burp funny? Tell me more about it.
Yeah, that's a great question. And also, the other thing that people assume because of their experience with fish oil is oxidation issue. Do I have to be careful about the heat and light and those kind of things? MCT oil is a very stable oil, unlike fish oil. So that's a real benefit. We're not nearly, I'm not concerned about temperatures, etc. And so, palatability wise, there is actually a study. Like I said, when I think of studies, I think of Lori McCauley. There's actually a study that C8 and C10 is very palatable. So we actually don't have to, you don't have to believe me. There's a study on it, but it is palatable. I mean, it's theoretically odorless and tasteless. Okay,
Oh, okay.
that's theoretical. I think the dogs like the texture, and I will confess that I like the texture. So when I will just take it off the spoon because MCT is, like I said, tons of research for people. So I take it also as a supplement. And what my brain reads it as when I take my spoonful is the movie theater butter on buttered popcorn. Like that's the flavor that my brain reads. It's not reading the flavor though. It's reading like that buttery, velvety texture of the oil. So yes, I we have not had any reports of anything that you just described, but I get it. I don't eat fish either, and I get the whole grossness that you reference, and that's not relevant here.
Excellent, excellent. So then I have to ask, because I'm always curious, you say spoon, teaspoon, tablespoon, and I have to ask what the human dosage is, if you know it.
Big dog size, off the record. So it goes by the dog's weight and it's right on the bottle. But yes, so the answer is yes, teaspoon and tablespoon. So I think it starts at like an eighth of a teaspoon or something and then works up from there. I would like to share something crazy with you guys, and
Yeah.
it could get me in trouble. So I'm going to try to say it as diplomatically as possible. But I think it's important that you know this, and it ties into how we tell people to administer it. Um, there's a body called NASC that you may not have seen the label, the seal of approval, NASC, and it was founded by a guy, and I am an NASC member, our company, so we pay a fee monthly to be a part of that, and it's a really good resource that even some federal government agencies utilize, but in some situations, I don't 100% agree, as life goes, right? with the way things are set up. And so our product is not NASC certified. And here's why. When you're bringing a supplement to market, it has to come in under one of two categories. It either has to come in as a food supplement or it has to come in as a health supplement. In order for it to come in as a food supplement, that ingredient or ingredients has to be in the book, the master book of what can be a food supplement.
Mhm.
And MCT is basically ahead of the curve. We're ahead of our time, if you will, and it's not in the book. And if it's not in the book, it can't be a food supplement. So we're left being a health supplement because we can't physically be anything else. So ours is a health supplement. We're very careful with the claims, etc. I respect and understand all that. NASC helped us with our label. But because we're a health supplement, the rules are you can't tell people to administer the product in the dog's food because that's only for food supplements. So do you see like the circuitous
That's,
red tape
yeah.
problem? So I said, here's what I'm going to do. I'm going to do what's best for the family and the dog and tell them you're going to measure it out in teaspoons and stir it, put it on top of your dog's food or stir it into your dog's food. Like that's common sense. How else are you going
Right,
to get this in your dog? A syringe?
right.
And so because I did that, and that's on our label and in our website, et cetera, we can't be NASC approved. So that's a little backstory there that ties into the teaspoons and tablespoons.
Isn't it amazing the red tape? And I know it's put in place to try to prevent charlatanism and negative things, and
It is.
sometimes it's crazy. So real quick, I've got more questions, but Marian said, how much, oh, she said, how about MCT oil? It's awesome for seizures. So,
Okay, so let's talk about that. That's so fun. So I want to send you the white paper because it covers every relevant study that's ever been out there is in our white paper and the references for you. So when I think about MCT oil for senior dogs with cognitive help, I almost think of it as like universally helpful, like snake oil. And that's again back to not only my personal experience, but back to these studies where they took dogs and they had 6 measures of cognitive tasks and they said, after 30 days on MCT oil, they improved in 5 out of 6 measures. And after 90 days in MCT oil, they improved in all 6 of the measures. Like it's really reliably helpful. It's
mhm.
not the case for seizure dogs. So, yes, can be awesome. If it helps your dog, I mean, it's a world-changing supplement. I mean, it's amazing, but it's not as universally helpful. So, in some of the studies, the I can't quote the numbers off the top of my head, but improvement in seizure frequency, like notable, like I don't know, 50%. I'm just somewhere in
Wow.
there. It wasn't 7%. It was a big number. Improvement in seizure frequency, in improvement in free seizure intensity. So yes, 14% of dogs stop seizing altogether. We're talking about idiopathic
Wow.
epilepsy.
That's
So
amazing.
14 seems like a small number, but if it's your dog that
Right.
stops on
Absolutely.
MCT oil, that's amazing. So yes, to your point, it can be phenomenal, but I don't want to put it out there as the panacea for every idiopathic seizure dog.
Awesome. All right. So we've now talked about feet. We've talked about the brain. What's next for the senior dog company?
So it's so crazy that we're doing this today because I had a meeting today that was the culmination of, I feel like 28 years of work and certainly a year of very intense work with multiple veterinarians on my team. And we have a supplement coming out in the next 6 to 9 months
Ooh,
that is there's nothing else like it on the market and it's going to be a game changer. And I'm going to leave it at that because it's so unique that I think we could probably get a patent on this formula. And
yeah.
it's not that I want to be exclusive in this world, but sadly, um, there are so many knockoffs of every product I do. I'm going to deal with knockoffs, and it hurts because and I know you know this, when
Mhm.
you pour your time and soul and life savings. I mean, in the process of bringing toy groups to life, I almost lost my house. I like emptied every account, every retirement, everything that you're not supposed to do. Like I poured everything into it. And so when you put all that out there and then somebody else swipes your whole sizing chart, every image you've ever done, your pictures, and you're like, wow, life's not fair. So
Mhm.
this may be a patentable thing. I don't know. I'm gonna have to talk to my lawyer, but it's like nothing like it exists right now. So I'm very
Cool.
excited. So that's coming, and then some other supplements. Again, I don't want to sell things just for the sake of selling things. I don't want to be like, come to my website and buy this dog bowl in 8 different colors and 62 leashes. I want to sell novel things that solve problems for my patients and
Hmm.
by extension, the senior dogs of the world. That's what keeps me up at night thinking about this. So there are supplements that I want and that don't exist. And then also we're going to be doing other products. I don't know what to call them, like hard products that are like actual things that the dog will use. And then education's always going to be a hallmark of what we do. So I would love to invite everybody to go to our blog. There's a search bar. I think there's like 300 some blogs or more up there now, like I said, that are all veterinary vetted and hopefully are a good resource for your clients that you feel good about recommending them to go read, because the other hallmark and core value that we operate under is there's a lot of internet on the information on the internet where it seems to want to create an adversarial role between the client and the vet. Like,
Ooh,
you need to read this information because it's what your vet's not telling you. And that's not ever how
yeah,
we're going to operate. We are, here's this information.
right.
And the goal is that you're better informed to have better conversations with your veterinarian
Mhm.
and work as that team for your dog's health. So I don't know. Long answer to your question, but just continuing the mission of education, empowering and innovative solutions.
Excellent. Excellent. I'm going through the questions. Shirley O, it said you have questions. So if you want to type them in, go ahead. And I'm just reading through these. We talked about noise sensitivity and seizures. Everybody's dog. So Loranda, AJ basically said that their dogs did great with MCT oil. Marion said he had focal seizures and they have nearly disappeared, but he's
Awesome.
also on gabapentin. His brother has worse seizures and only on MCT, now virtually no seizures. I give it
That's
to both my dogs and their food, just difficult to find dosage amounts.
yes.
And
That's why that's why I love that we're a veterinary product and we've already worked all that out scientifically. So it's our product's on Amazon now too. So you or our own website, but you can go on Amazon and you'll see all the panels, and so you can see how we dose it right on the back of the bottle.
excellent. Yeah, and I would just call out that if you have the two special, what'd you say? It's 8 and 12? No, it's 8 and 10.
10, 8 and 10. It's
Eight
all
and
you.
10. And there's other products out there that may have 6 and 12. You definitely don't want to take those dosages. You want to make sure you get the brain boost and then use the proper dosage because you've taken the time and done the research to find out what the best dose is for each size dog.
And
And
I think it's confusing, and I don't think intentionally, but especially if you're using a human product. I had someone at a conference come up to me and say, "I'm already using a 8 and 10 product," and I said, "Okay, show me." And so when we looked at the bottle, it did only say 8 and 10. That's all it said, but it also was only 84% of the product. It was 84% 8 and 10. Well, what's the other 16%? I don't
right,
know. I don't want anything else.
right, right. And that means that if you would take the same amount, you wouldn't really be getting the same amount because it's only 84%.
Right.
All right, so we have a question from Shirley. I tried toe grips on my small 20-pound dog a year ago. I had read that it was necessary to keep them away from the base of the nail bed. I thought I had, but then the nail got infected and the nail fell off.
Oh
Not
my gosh.
too close. I would love to use them, but eventually the toe was amputated. The
Oh,
rubber boots and socks
are
are
you a
just
plant,
not
Shirley?
working. My gal is 16. Did I do something wrong?
Okay, I'm so like that's the worst possible story that I've ever heard. It's not the only time I've heard it. I have probably heard this 2 dozen times in the past 13 years, and it kills my soul. And I'm so, so, so sorry, Shirley, that you went through all that. Like, that's terrible. What I can tell you is when used properly, it cannot happen. I would stake my life on it. So, and I don't mean that offensively at all because I know you tried to use them properly. So we need to do better on our messaging. And over the years, we have worked very hard on that. On the nail tip, they're supposed to be on the caudodistal nail tip. I have people ask, like, does it Does it grow fungus under the toe grip? Like, can it squeeze the quick and cause problems? No, 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 no. There are no problems on the caudodistal nail tip. However, dogs can wear these for months. If over time it migrates up to the nail bed, which is where the nail grows out from, that's now soft tissue. And you can't have a tourniquet on soft tissue for any length of time before you run into issues which start with a sore, can go to infection, and can affect blood supply, which I guess is where the nail falling off would come into play. So I'm horrified. I'm so sorry. However, and not really a however, I mean, period. If they never contact the nail bed, it won't ever happen. And so that's why they're colored. Toe grips are colored for a reason. I want people to look at them every day. We try to include this it's very important in our messaging. You can't just set them and forget them. You look at them every day. You make sure that they're, the toes, the nails, everything looks good and they're not rubbing on any soft tissue. So I don't know if that answered your question. If you would want to try again, I would be happy to send you another complimentary set. You can DM me on Facebook. Um, and I can look at pictures of your dog's nails and make sure there's enough length of the nail that the product makes sense and it wouldn't automatically with being applied bump into the nail bed. So let me know how I can support you in any way, but I'm so very sorry that you and your dog went through that. That makes me really sad.
And let's just say that, give me an idea, a rough estimate, how many hundreds, thousands, millions of packages of toe grips have you sold, Julie?
We're getting close to 1 million.
Wow. So yeah. So yes, you've heard it, what'd you say, like a dozen times or so out of 1 million, that is
Yeah, and I'm not talking about toenails falling off, like, oh, they caused a sore at the nail bed. I mean, it does happen, but it happens when they're touching soft tissue and they just can't.
they just can't, right? Okay. All right. Rose says, can MCT cause issues with pancreatitis dogs or GI sensitivity? Are there any contraindications with joint foods like Foresight or Anatol Plus?
These are great questions. Okay, so first part of the question was pancreatitis. So
Mhm.
my answer to you is I'm always going to be transparent. Um, we tell people, and I do this for any supplement, start small and work up. So it's right on the bottle. I want you to start at a quarter of the dose. And like I said, I do this for any supplement I put a patient on. Start at a quarter of the dose and work up over a couple weeks gradually. That's just to let the tummy adjust. Can it cause GI upset? So we've been selling this since January. And I told you that there was a vet that I worked with in Australia. They had been working on this formula and selling it wholesale to vets for 3 years prior.
Right.
She had two young children and she didn't want to pursue this anymore because the bottles that they had bought, they had shipped with the pumper in the top of the bottle and all the bottles were leaking. And so when I met them, they had a whole bunch of leaky expired bottles, but they had this formula and they had a lot of information. And so I essentially bought from them, not any product, but basically bought their information so that I had that as a baseline for my year of research. So I have like 4 years of data of it being used on patients. We have had since January 2 cases of people describing GI upset from the product. So that's two out of, I don't know how many, a few thousand. No, more than that. 4,000 maybe.
Wow.
So yes, it can cause GI upset as anything can.
Mhm.
Pancreatitis. Because they're medium chain triglycerides, the theory is they don't stimulate the pancreas like the long chain triglycerides and like C12 is getting to be a long chain triglyceride. Those are processed in a normal way like a fat. So theoretically, C8 and C10 are not associated with pancreatitis in the literature. I would say use common sense. I'm still like gonna err on the side of caution. And we have had one dog who was diagnosed, owned by a vet who was diagnosed with pancreatitis after starting our product. However, the dog I think was 15 and had like a huge litany of problems. So could be the product, could be huge litany of products and just bad timing. I don't know. We'll never know. But it's on paper not associated with pancreatitis, but I give it to a chronic smoldering pancreatitis dog? I wouldn't. I would just err on the side of caution there. And for everything in life, it's the risk reward ratio, right? I mean, is the cognitive dysfunction so bad that the people are talking about euthanasia? I'm gonna try it because I'll take that. Is the dog basically okay, an older dog with a little bit of cognitive dysfunction and has struggled with pancreatitis, then I'm not gonna use it. So those are kind of the decision-making algorithm. Prescription food. I don't think you need to prescription food, as we know, like joint food, they don't necessarily put a high level of a therapeutic level of ingredients in. So like a dog on joint food, I don't think they're getting the doses that I would want of supplements that I use for joints. If the dog was on a food that, so like Hills BD, Purina, NeuroCare, so these prescription diets that are working in the same kind of way, I don't think I would also add in Brain Boost. But Antinol Plus, that's a fish oil product, I believe. Um, so that's a whole different thing. So yes, I would feel comfortable doing it with a supplement like Antinol. I do think you can over oil the dog. So if you're giving the dog a bunch of fish oil and then you're going to add an MCT oil, I think that's kind of a recipe for disaster just based on volume of oil. And so you may need to kind of titrate down to to just not cause a sheer GI problem from oil.
Well, and make sure that the dog's not gaining weight because they're getting so many calories from the oil.
Yeah, great point.
Yep. But hopefully they'll feel so much better that they'll be more active and be able to burn those calories off.
And in people, MCT oil is associated with better metabolism and weight loss. So
Oh,
another
yeah.
another reason I'm taking my buttered popcorn.
Yeah.
So we have a question from Marion that her dogs are in the bush most of the time, and will the toe grips come off because of that?
Marion, are you also in Australia in the bush? We've got everybody in the bush here.
We have a
Um,
big Australian following.
oh, that's so great.
Mhm.
So we're gonna say I would have said yes to rain is an issue prior to what LaRonda said earlier, which was my dogs are in the bush and the toe grips come off. So my answer, and LaRonda has experienced this, is using super glue, and I put my link in the chat there of a little video of how you can use super glue. So if you told me that your dog's doing agility or your dog's like running through the bush as like a normal part of life where there's potential to get snagged and hooked on things, I don't know that I'd be using toe grips because I think they increase the friction of a potential snag. But if you've got a senior dog that's plodding around and when they're out on that rougher terrain, the toe grips may come off. Yes, that's a place that I would glue toe grips. So I hope that's a complete answer. Let me know if you have a follow-up question.
I do want to throw in here that Ellen said Dr. Busby's toe grips make a great Secret Santa gift.
Oh, Ellen, I'm hiring you for my marketing director.
We love Ellen.
Mhm.
I have a question from AJ. Should Brain Boost be used proactively? I have two 10-year-old labs
One,
already on MCT oil.
oh, good. Well, I don't know what you're using. I would encourage you to compare it because I don't know of another product like our product, but 100% proactively. So when we first launched, and even I was saying this at VMX this year in January, people would ask me this question, and I was like, no, let's wait until you see symptoms because I don't want you spending money that you don't need to. And I don't want to sell you something. I've completely changed my tune. And the reason I've changed my tune is number one, MCT has so many beneficial effects. I mean, even if we just took neuroinflammatory and nothing else, like what? That's priceless. But
Yeah.
the other thing is what I've already talked to you about. Even the best of us just tend to miss these symptoms. So, the peak of the iceberg, I don't want to wait till I'm in the top 2% of the iceberg and say, oh, let's put our dogs on MCT oil. We need to be working down here. So, 10-year-old dog, absolutely. 6-year-old dog, I don't know. 8-year-old dog, depending on the breed. Yeah, I'm leaning that way, 10 for sure.
Cindy says, how long have you been adding Brain Boost to your own diet, and what have you noticed differently about yourself, if at all?
So, I've been using it for almost a year now. And my problem is I'm not consistent because I am just my life gets in the way, and I'm not like the kind of person that takes my supplements regularly every single day, even though I totally know I should. So I haven't taken it every day. I take it like the days that I remember, and I take it. It almost is like a treat for me. Like I can substitute it in for dessert because of, like I said, that texture is just fun. What have I noticed? When in the beginning, I did take it really regularly because that's when I was in my R&D phase. And the big thing I noticed is I'm a menopausal lady who doesn't get enough sleep, and I do have brain fog, and it did help. It did help. I was like, am I imagining this, or am I just thinking better? And I was joking with my team, and they're like, you're on fire. I'm like, oh, go MCT.
Awesome. Awesome. Elaine says, what's a good omega for highly GI sensitive, tiny 2 to 6 pound senior dogs? Despite being high quality, even algae based, and starting low and slow, we have not been able to find anything that has been well tolerated.
So 2 to 6 pounds. I mean, is it not well tolerated because of the product, or is it not well tolerated because you struggle to get the dose low enough that makes sense? I don't know, Lori. I'd love your thought on this, but I recommend Nordic Natural products, and that's the brand that I use for omegas, and they do come in a liquid, so you should be able to titrate down to a tiny enough dose. What do you? And that's not plant-based. What do you think, Lori?
I personally use Nordic Naturals, and I always recommend rotating to see how the dogs do with it. Um,
Smart.
Dr. Tobias's Feel Good. I love Standard Processes, VG or VF Omega. And with that, I would literally just pop a hole in the capsule and just squeeze like a drop or so out. And, with a 2 to 6 pound dog, I mean, that is tiny, tiny. You don't need very much. Um, Great. So it's nice to see that we have the same recommendations. All right. So Cindy says, is there a contraindication to have patients on Brain Boost and fish oil products like Welactin?
No, and I have so many people come up to me at conferences and tell me I'm already on an MCT because my dog takes Welactin. So it's a really good question, and thank you for bringing that up. You know this
Mhm.
because you asked the question, but Welactin's not MC. Welactin's great. I love it. It's not an MCT product. So the contraindication is kind of what we talked about earlier. I think you can cause GI upset by over oiling the dog, and I don't have a standard answer on how you fix that, except for I think you have to look at, again, risk versus reward benefit and titrate accordingly. And you can do omegas that are more concentrated, so it's not as much oil, but I would be concerned about adding large volumes of liquid oil to the diet, and then depending, the liquid MCT brain
Right.
boost as well.
Well, and I wonder if you feed twice a day, if you could give one oil in the morning and one oil at night so that it's less likely to have that slippery issues.
I will say brain boost is twice a day,
Okay.
but I think your idea is smart. I think, we have to get creative with our senior patients, and it's not always the gold standard. Sometimes we're on the silver or bronze standard, and as long as it's working, we're happy.
Yeah, absolutely. And there's nothing that's perfect for every dog, and there's a lot of things that can help your dog.
Hmm.
Sometimes you just have to figure it out. So Michelle says, can Brain Boost be given with other TCVM supplements?
Absolutely.
Excellent.
And medications.
So is there any drugs or anything that you would say if there, besides we just talked about the oils, is there anything that would have a contraindication?
In the literature, you read about it affecting the cytochrome P450 pathway. And so, like potentially a phenobarb, etc., in the literature. I don't know. I've not read anything actually in people or dogs where that played out to be impactful, but we do talk about it in the white paper. So, like I said, let me send you that for the details.
Excellent. Ellen says, my German Shepherd dog Bella used toe grips for years, recommended by Dr. Macmillan. When bored, Bella loved removing them with her teeth. She never swallowed them and rarely damaged them. Bella remained very mobile until her 15th year. Thank you for toe grips. And I can tell because Julie knows this too. When I had my golden, he was one that I would put them on and then I would leave my office and I would come back and there'd be like two or three gone. and he would just wait till I left and then just pull them off. And if I remember correctly, is it like 2% of dogs who like to pull them off?
Less than that. So in the beginning, we said 2% because, we had a year of data. We now have 13 years of data. I'm gonna completely look like a fraud here because the issue with a nail bed problem is like so incredibly rare. I mean, when I went to our lawyer for putting our package together, and because we redid our packaging a couple years ago, and I said like, here's the statistics, and I want to know how to say this. And he's like, those kind of statistics, it's so rare. You don't put that on your package. Why would you say that? And I said, well, I am saying that. I'm saying that everywhere because above all, do no harm. I want to make sure people watch out for it, but it's so rare. Dogs chewing off or like bothering with their toe grips, like less than 1% of dogs. It's the number one question. So everybody who's not used toe grips, that's what everybody assumes. Everybody's like, oh, my dog would chew them right off. But it's on the caudodistal nail tip, which is poorly innervated. You got the quick, which is inside this, hard um, nail. It's not like it's on sensitive tissue like boots or socks. So it's really uncommon. And I see it more in like the OCD personality dogs or the dogs that are
Yeah.
like bored and looking for a way to, to do something. Or maybe the toe grips are kind of an innocent bystander in a dog with terrible atopy that's looking at the paws. But yes, thank you for your thank you for your sweet comment. And I'm so sorry that that happened to your dog. I'm glad that she didn't ingest them.
Yeah, well, and I think, sometimes it's that dog that's like curious and they just have too much time on their hands, right? And I worked with Ellen with Bella in an exercise course a couple years ago, and sweet, sweet dog, and Ellen's amazing. All right, let's see. We've got Elaine says, my 12-and-a-half-year-old senior dog has changed greatly since having bilateral mammary gland tumor and spay at the age of 10. She's gently cooked fed with MCT oil and various holistic supplements, but yet her hair is thinning and her reactions have changed. Um, so
Okay.
yeah, go ahead.
Well, so I don't know. The first thing I think about is just like in older people, when we have surgery later in life, there can be some issues with anesthesia. I definitely am a proponent. Just because a dog is older doesn't mean they shouldn't have anesthesia. When I owned my practice, I did so many dentals and dental extractions on 15, 16. My oldest was a 21-year-old dog. So it's not that you shouldn't have anesthesia, but there are some issues that can happen that can impact the brain, like little micro strokes under anesthesia.
Mhm.
When you're describing the hair change in a 10-year-old dog, what comes to mind is Cushing's disease and thyroid disease, both metabolic diseases. So I would encourage you to talk to your vet and get some blood work run. Whenever I do blood work, I like to combine it with a urinalysis. So you get a free catch first morning urine sample and take that in to the appointment to have that run with the blood work and start there. So that would be my advice is like, let's start and just make sure metabolically we're not seeing any red flags because there are lots of things we can do for those things in Western medicine and in alternative medicine, but knowledge is power.
Yes, absolutely. So Rose says, if your Aussie contact is not selling, where can I get it from, please? And as Foresight Forte is plant-based food, is MCT okay with it? Now becoming very popular, a joint additive.
Is this is in Australia?
I'm thinking that's what I think Rose said she was in Australia. So can they get both toe grips and brain boost in Australia?
Toe grips, absolutely. We've shipped now to like 55 countries and we ship to
Awesome.
Australia routinely. I think it's our third or fourth most popular country to ship to. So no problem on the toe grips. The brain boost, we cannot ship to Australia yet, and that's a regulatory thing, and we're working on it. We're also working on distribution. If you know of anybody that could be, and specifically someone who already has the infrastructure of distribution for veterinary products, I would love to connect with them because that would make it a lot easier as well. And combining with a plant-based product, its MCT oil is really not contraindicated with other things, so I'm guessing it's fine with what you're describing. Like I said, my only caveat is don't over oil your dog. If you've ever had a horse that's colicking, like you're just pumping oil into them to give them diarrhea, we don't want to do that with all this oil into the dog system.
Okay. I see, so great answer. I see Elaine says, I've given Dr. Tobias calamari oil. I think I've tried everything unsuccessfully, including Nordic Naturals and Potency. I'm at a loss. Elaine, I will say there is also a QD Omega made by, oh, her name is Debbie Decker. And that's another one that sometimes I'll recommend. So if you want to try that one, you can get that one online. Michelle says, thank you. Cindy says, thank you. Foresight is in the USA, I thought. I guess I'm not super familiar with the number 4 CYTE. Um, I would have to look it up,
Yeah,
Rose.
I will look it
Sorry.
up.
All right, so how can people find out more about toe grips, brain boost, and other things? Um, I assume that Christine is going to put all of your contact information into the chat as well as when we put this on YouTube and other places. Is there, uh, let's see, is it okay to give with cod liver oil?
Same answer. It's perfectly fine from a interaction standpoint, no problem. But oil, oil, oil.
Right. And Marion popped in that Foresight is greenlit mussels, mussel
Oh,
extract. So yeah, absolutely, that should be fine with that, I would assume. I
I
mean,
love green lip mussel. We actually have another product that's green lip mussel based, and yeah, amazing.
excellent. All right, thank you everybody for coming. For those of you who are watching this after tonight, thanks for watching. I hope you had fun. I hope you learned something. I know I learned a lot. Julie, it's wonderful to see you. Thanks for coming on. And
Thanks so much for having me.
yeah, and hopefully we will see you very soon.
Yes, and if anybody has any questions, follow up, or wants the white paper, you can DM me on Facebook, reach out through really any social channel, and I'm happy to mail that to you. And I thank you for spending your evening tonight listening to Laurie and I chat about these things. I appreciate everybody's time.
Yes, thank you everybody, and thanks for all the thank yous. Everyone have a good evening.